In today's special report on T.H.E.M.ES Agenda this week, Aderayo Idowu Olaiya of our News and Current Affairs Department analyzes the role of the Lagos State Health Management Agency, LASHMA, in line with the T.H.E.M.ES Agenda of Governor Babajide Sanwo-Olu. At the inception of the administration of Governor Babajide Sanwo-Olu, one of the promises he made to Lagosians is to ensure and provide effective, accessible, affordable, and adequate healthcare delivery system to the teeming residents of the state. The governor immediately put action to his words with the commissioning of a 110-bed maternal and child center (MCC) in a T.H.E.M.ES area of the state, a health facility built by the Lagos State government to provide specialized services to mothers and children. This gesture is no doubt an evidence of Sanwo-Olu administration's resolve to transform public health in the state. At the commissioning, Governor Babajide Sanwo-Olu promised to construct a general hospital at Etiosa to serve the health needs of the catchment population of the local government area. Barely 1 month after, Governor Sanwo-Olu also inaugurated a 149-bed maternal and child center (MCC) in Alimosho General Hospital in Godo, with a pledge to set a 6-year target to achieve universal health coverage, as well as work assiduously towards achieving the goal of making healthcare accessible for all residents by 2025. This is aimed at invigorating and carrying out the mandate given under the second pillar of the T.H.E.M.ES Agenda, accommodating health and environment.
As you know, health is a strong cardinal under our T.H.E.M.ES Agenda. It's the second pillar, which is under health and environment. And healthy citizens build a healthy society, and by extension, it builds a healthy economy. We are laying no stone unturned to provide full equipment for modern health facility all around Lagos State. Where necessary, we'll build brand new health facilities. Where appropriate, we'll renovate and upgrade existing ones.
Going by the World Health Organization, universal health coverage targets that people have access to needed health services, including prevention, promotion, treatment, rehabilitation, and sufficient quality, while also ensuring that the use of these services do not expose the users to financial hardship. The present administration of Governor Babajide Sanwo-Olu again has taken a giant stride in ensuring that Lagos attains this height through the Lagos State Health Scheme, LSHS. LSHS is a public health insurance initiative for citizens of all ages within the 20 local government areas of the state, accommodating the local council development areas as well. However, the governor approved the commencement of the Lagos State Health Scheme, LSHS, for its employees with effect from 1st June 2020, with payment of 75% of the annual family insurance premium for each public servant. With the takeoff of the Lagos State Health Scheme for the staff, public servants have access to medical care in any of their chosen facilities among over 200 hospitals under the Lagos State Health Scheme spread across the state. The Lagos State Health Scheme, LSHS, was birthed as a child of necessity to bridge the gap of deficit in the health sector. The scheme, with an individual payment of 8,500 naira, also has a family package of 40,000 naira covering the father, mother, and 4 children. After the payment of the premium, the enrollees would enjoy benefits, which include enrollment and consultation, treatment of common ailments such as malaria, hypertension, diabetes, family planning services, dental care, ultrasound scan, radiological investigations, and child welfare services, care of childhood illnesses, neonatal services, gynecological prenatal care and delivery. Lagos State Health Management Agency, LASHMA, the regulatory body of LSHS, is not resting on its oars to ensure a massive sensitization campaign that will bring every resident abreast of the nitty-gritty of the scheme. Faced with the challenge posed by the COVID-19 pandemic, Lagos launched a virtual medical consultation service, T.H.E.M.ES, for residents as part of efforts to protect citizens and reduce their risk of contracting COVID-19. T.H.E.M.ES was designed by the Lagos State Health Management Agency, LASHMA, to increase access to care, reduce the challenge of going to hospitals during the pandemic. The general manager of LASHMA, Emmanuel Azamba, said through the project, residents would have access to highly trained and experienced physicians for non-emergency primary care consultation through voice or video.
It is a child born out of the COVID-19. There was the lockdown, and some people will still need care even during that period. It is not only COVID-19 that was and is an issue for us. I mean, we have maternal mortality, child mortality. You know, our indices, they're not fantastic. So we needed to find a way to allow people to still have access to care during that lockdown. so that we reduce their risk of exposure for COVID-19, both to the patients and also to even the health workers in the facilities. So that's why we came up with the T.H.E.M.E, and Governor graciously approved that it should be provided free of charge to residents in Lagos State for, I think, about 2 months when we first started. In May till July, it was free. Call in anywhere you are and they would attend to you. You are entitled to the service as an enrollee.
Early this year, Lagos State government commenced grassroots enrollment of residents in 20 local governments and 37 local council development areas of the state for the Ilera Eco Health Plan under the Lagos State Health Insurance Scheme. Ilera Eco initiative is aimed at boosting healthy and productive life in Lagos despite the economic challenges and emergence of the COVID-19 pandemic. T.H.E.M.E also introduced Ilera Eco Pay Small Small, whereby an individual pays 3,000 naira as initial payment or 10,500 naira for family of 6 to have access to healthcare for 3 months, and with timely payments of the same amount every quarter, or 1,000 naira monthly or 3,500 naira monthly. Individuals or family will enjoy Ilera Eco at any hospital of their choice. Like the Lagos State Health Insurance Scheme, the Ilera Eco benefits package include registration and consultation, treatment of common ailments and conditions such as malaria, typhoid, diabetes, hypertension, asthma, HIV and TB, as well as pharmaceutical care and minor surgeries such as incision drainage, aneurysm and appendectomy. T.H.E.M.E's Ilera Eco grassroots sensitization has so far reached Agege Primary Healthcare Center, Agege Local Government Area, Oshodi Cairo Market, Oshodi Local Government Area, Akerele Primary Healthcare Center, Surulere Local Government Area, Alimosho, Ikorodu Local Government Areas, as well as Odiolowo Juwe Local Council Development Areas, Mushin, with plans to move around all the 20 local government areas of the state. The scheme also enrolled 200 youths and women who participated in the National Productivity Center training facilitated by Senator representing Lagos Central Senatorial District, Oluremi Tinubu, in its determination to ensure that all the residents in the state, irrespective of their social, cultural, and economic difference, have access to affordable, equitable and quality health care. The Lagos State government granted free health care to 15 people living with disability in Ikorodu. In addition, according to Mrs. Zamba, grassroots sensitization program has been intensified for Lagos residents as Governor Babajide Sanwo-Olu's administration is passionate that every resident live a healthy life.
We know that there's already private health insurance in Lagos that services mainly the formal sector and corporate Lagos, let me put it that way. But the people that are largely uncovered in Lagos are the informal sector, which make up about 70% of our population. And we really did feel that the name we were using was a little bit of a mouthful, and we needed people to, when they hear this call, they would understand immediately without you having to, speak too much grammar. So literally, we felt that instead of the mouthful that we were Lagos State Health Scheme, let's transit into something that would be like a call to action for Lagos residents, regardless of your socioeconomic status. Ilera Eco means what? Healthy Lagos. Health of Lagosians, so to speak.
Health insurance no doubt protects one from the financial burden of an unexpected medical bill. Some Lagos residents react to this development.
It's very, very important. It's good.
No, I've heard about it, but not much. I don't put much interest. Number one, I thank God for good health for myself and for my family. Maybe that's one of the reasons why I don't put much interest in all those things. But anything can happen at any time, I know. You understand? That's just the reason.
They have to, what they could have done, they have to take it to the grassroots level. In the sense that they will go from house to house to campaign.
Yeah.
So I will advise people to go into it.
With plans to achieve universal health coverage and promise to work assiduously towards achieving the goal of making healthcare accessible for all residents by 2025, there is a clear signal that the Lagos State government is poised to effectively carry out the mandate given under the second pillar of the T.H.E.M.ES Agenda, accommodating health and environment. The Lagos State Health Scheme, LSHS, no doubt is a child of necessity, better to bridge the gap of deficit in the health sector, which Lagos residents are advised to tap into to achieve a universal health program for all. This is where we conclude this week's edition of the special report on the activities and achievements of the T.H.E.M.ES Agenda, which analyzed the role of the Lagos State Health Management Agency, LASHMA, in line with the T.H.E.M.ES Agenda of Governor Babajide Sanwo-Olu. For feedback, you can follow us on our various social media platforms: Twitter, Lagos Traffic 961, Instagram, Lagos Traffic Radio 961, Facebook, Lagos Traffic Radio 96.1 FM. On YouTube, subscribe to our channel, Traffic Radio 961. Also, you can now download our app, Lagos Traffic Radio 96.1 FM, from Play Store for more traffic updates. This program is a production of Lagos Traffic Radio 96.1 FM. I am Abiola Fagbolago.
T.H.E.M.ES Agenda this week analyzed the role of the Lagos State Health Management Agency, LASHMA, in line with the T.H.E.M.ES Agenda of Governor Babajide Sanwo-Olu's administration. There will be a repeat broadcast just after the news at 9.